will be about the impact of the electronic health record on your healthcare facility. Our agenda for today is to discuss whether implementing an electronic health record will be beneficial for your facility or not. We will first discuss whether or not your facility actually needs an electronic health record and will it be cost effective. We will then talk about the benefits and problems with the electronic health record and how implementation can affect your facility's efficiency and quality of care provided to patients. Assessing needs will provide more information about whether an electronic health record for the facility is necessary. As Gustafsson et al. Have stated, it is very important to determine information requirements. First, future issues must be identified, and then identifying information needed for selected issues. An analysis of the information must take place and identify information that should be collected on a regular basis and information that will need to be computerized. Also, identifying the workflow of the facility is a very important component as well, as stated by Piechowski. Cost is the main component to look at when thinking about implementing an electronic health record. Electronic health records are expensive, but when implemented well, they can pay for themselves and reduce costs and enhanced revenue. Among the savings that electronic health records offer are reduced costs for transcription maintenance and management of paper charts and improved coding. However, it is important to keep in mind that the net benefit to be derived from an EHR could take 5 or more years. Electronic health records are consistently more accurate and complete than paper charts. Some of the benefits of an electronic health record are the reduced chart and storage expenses. Electronic health records help reduce costs incurred by paper charts, papers, folders, dividers, filing systems, racks, and cabinets, and convert the space into offices or exam rooms. Utilizing an electronic health record assists a facility in being more efficient because it provides many functions, such as ordering tests, prescribing medications, and looking up test results. Electronic health records also increase revenues through improved coding by reducing the tendency to undercode. The electronic health record is accessible to every authorized staff member, clinical or administrative, from multiple workstations at any time, regardless of others viewing the same chart. Electronic health records significantly improve the speed and efficiency of communication among employee and providers, thus decreasing errors. The electronic health record improves quality of care by providing physicians with alerts to remind them when a patient needs to have a specific test done, such as a mammogram, colonoscopy, or routine test for a chronic condition, whereas with paper records, a physician or other healthcare provider would treat symptoms when they became bad enough for an office visit. By utilizing the electronic health record, the health facility can send out notices to the patient for upcoming tests needing to be conducted. The electronic health record focuses on prevention by allowing a physician to use the proper tools within the system to instantly search through many patient records and identify those who need intervention and tests. The electronic health record also enables patients to access their record online and ask their physician questions electronically round the clock, thus allowing patients to be more proactive about their health. As Dr. Susan Smith states, instead of just being an electronic medical record, the electronic health record becomes an interactive tool to help physicians provide care. As noted by Don Francesco, the implementation of an electronic health record is a lengthy process and can be quite stressful. Implementation of an electronic health record, as stated by Don Francesco, can result in many changes, causing some jobs to disappear, some new jobs to be created, and some jobs to change. Vendor viability can be an issue with electronic health records. Many new companies enter the market and many companies leave the market every year. Companies either fail or become acquired by other companies. If a vendor is acquired required for their customer base, the current product of the acquired vendor begins to fall behind in service and usually becomes unsupported within the first year, which forces customers to either repurchase the software from the new vendor or look through the market for another solution, thus increasing costs and causing a lower return on investment. Security is a huge issue with electronic health records. A study done by the eHealth Vulnerability Reporting Program found that a hacker with rudimentary skills could get into systems, retrieve and alter data, such as changing medication dosages or deleting records and reports. Implementing an electronic health record is a significant organizational change. This implementation can cause anger, fear, and other intense reactions from employees. Therefore, it is highly important that the project manager develops an infrastructure that will carry out the implementation with explicitly defined goals. Therefore, great communication is the key in implementing electronic health record. Results from an American Academy of Family Physicians survey conducted in April of 2007 shows that the number of family physicians using electronic health record has risen since 2003. This survey shows that 13% of physicians are in the process of implementing the EHR, 26% plan to purchase the software, and 25% do not plan to implement this electronic health record. However, 36% have fully implemented the electronic health record. Compared to the results of 2005, about 30% of AAFP survey respondents were using electronic health records, and about 10 to 15% were using the technology back in 2003. EHR implementation involves installing a system and completely changing how the practice operates on a daily basis. It is important to keep in mind that when implementing the EHR, specific goals must be communicated and plans must address everything from workflow to hardware to software selection and installation and staff training. The amount of old data to load into the electronic health record system depends on the amount of time and money available. In addition, providers may stay late to handle the additional data entry for a few months or up to a year. It is advised that you consider everything presented to you through this presentation before implementing an electronic health record for your facility. Will it be cost-effective and facilitate in providing efficient and quality of care to your patients? Thank you, and I hope that this presentation